Good afternoon, everyone, and thank you for joining today's webinar, COVID-19 Strategies and the Importance of Good Data. I just want to give some time for others to join, so we'll get started in a few minutes. Thanks. Okay, good afternoon, everyone, and thank you for joining today's webinar, COVID-19 Strategies and the Importance of Good Data. This is a webinar for counties participating in the Pennsylvania Stepping Up Technical Assistance Center. I'm Gretchen Frank, for anyone who doesn't know me. I'm a senior policy analyst here at the Council of State Governments Justice Center, and I'll be moderating today's webinar. I wanted to point out that today's webinar is being recorded for anyone interested in the topic that were not able to attend. And the link to the recording will be sent out to participants of the TA Center after the webinar once it's available. It would be great if everybody could introduce themselves in the chat by writing your name and what county you're from as we introduce the webinar, just so that everyone can see who's on. Our topic today is COVID-19 strategies and the importance of good data. We've heard from many counties through one-on-one conversations and a survey that we did that data is at the forefront of your planning and a topic that you're interested in. So for this webinar, we wanted to discuss how data can be helpful during COVID-19 as we look at who is in our jails and how that informs both release decisions associated with COVID and how it informs general policy now and moving forward. This webinar centers around these challenges and opportunities. So we have an hour and a half scheduled for today. We likely won't use up all of that time, but we wanted to make sure that we had some time for discussion at the end of the webinar, since this is really the first opportunity that you've all had in several months to speak to and hear from and learn from one another, since we've been doing the one-on-one TA calls this year instead of the office hours. Since we'll likely have quite a bit of time for discussion at the end of the webinar, please make note of any questions or comments that you have. And anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right portion of your screen. This includes both technical and content-related questions. And we'll try to reply to the technical questions in the chat window as we go. For the content-related questions, we'll keep a running list and address them at the end of the webinar. If you encounter technical or audio problems during this webinar, please call WebEx technical support at 1-866-229-3239. There we go. So for our speakers today, we have from the Council of State Governments Justice Center, Risa Hannenberg, who's our Deputy Division Director of our Behavioral Health Division. We also have from Cumberland County, Pennsylvania, Annie Streit, the Mental Health IDD Administrator, and Rebecca Finke, Deputy Warden of Treatment. So first we'll set the stage a bit on this topic, and then we'll hear from Risa on data and prevalence reduction targets. Then we'll hear from Annie and Rebecca about Cumberland County's COVID-19 response efforts and any role that data plays in that response. And then we'll open it up for questions and discussion so that you all can hear from one another. So this slide just provides a little background on the Justice Center. We partner with the National Association of Counties and the American Psychiatric Association Foundation for our Stepping Up initiative. And most of you on the webinar are likely part of the TA Center and are already aware of what stepping is, so I won't go through an overview of Stepping Up. But if you aren't already familiar with the initiative, please feel free to connect with me after the webinar. You can reach me at gfrank@csg.org, and I'll have my contact information on the slide at the end of the webinar. And you can also visit stepuptogether.org, which can be seen here on the screen. And here are some of our key resources. Again, if you're not already familiar with any of these, feel free to reach out to me, and I'd be happy to provide them to you and go over them with you. And this slide covers key Pennsylvania Stepping Up accomplishments in comparison to where counties are nationally in these areas. As you can see, for the second accomplishment that's listed there, Pennsylvania now has 4 innovator counties. So that actually makes Pennsylvania the county that has the most innovator counties in the country. So we're really happy to report that and to recognize Cumberland County as Pennsylvania's newest innovator county, and we're also really grateful to have them participating in today's webinar with us. In case counties are interested in what it takes to become an innovator county or interested in becoming one, counties are eligible to become innovator counties when they have a shared definition of SMI that's used throughout their local criminal justice systems and behavioral health systems. They use a validated mental health screening tool on every person booked into the jail, and then they refer those people who screen positive to a follow-up clinical assessment, and they record clinical assessment results and regularly report on that population. So the fact that Pennsylvania is leading nationally in this area really emphasizes that so many of you and your counties are making significant strides in your work to reduce the number of people with mental illness in your local jails. And then the third accomplishment that's listed here is Set Measure Achieved. So I just wanted to say, in case anyone's unfamiliar with that, it's a Stepping Up national call to action for counties to commit to goals that demonstrate reduced prevalence of mental illness in local justice systems. And Risa, who's going to be the next presenter, will speak about this in more detail in a few minutes. But before we get into our presentations, we just wanted to display 2 quick polling questions we have for you all to get things started. And I'm going to put them up here. They should be able to see those, but the actual poll question should be to the right-hand side of your screen. So I'll just let everyone take a moment to answer that, and then we'll go over the results. Okay, so it looks like most people have responded to our first poll. So 38% of you said that conversations in your local criminal justice system are still currently focused on COVID-19. None of you said no, and 23% said somewhat. So thank you so much for responding to that, just to have kind of an idea of where everybody is right now. And then we just have one more quick poll for you. I'm going to put up here now, and we'll just give you one more moment to answer this. You should also see this on the right hand of your screen now. Okay, so I think we've gotten a good amount of responses for our second polling question as well. Has data informed your county's decisions around not bringing individuals to jail or releasing individuals from jail? 35% said somewhat, 4% said no, and 19% of you said that yes, it has. Thank you so much for responding to those polling questions. And we're now actually just going to show you a quick video that the Justice Center developed. And this video highlights some of the challenges that many of you are likely facing now and sets the stage for what we'll be covering today. And I believe that's also going to be on the right hand of your screen. Oh, sorry. I think we're having a little bit of technical difficulties. We'll get there. Oh, okay. Sadly, it doesn't appear to be working, but I can send that to you all after the webinar so that you have that. Oh, okay. All right, and now I'm going to turn it over to Risa.
Hi, everyone. I just wanted to make sure everyone can hear me. Thumbs up. Okay, great. Hi, everyone. I'm Risa Hanneberg with the Justice Center, and it's been a while, I think, since I've talked with the Pennsylvania group, so it's really good to be with you guys again. I really encourage you to, if you can, it's a very short video. In fact, we call them vids now when they're this short. Really encourage you to watch it, but just, to let you know that we had interviewed a couple of sites that are actually innovator sites that have been doing a nice job of tracking their prevalence rates of those with serious mental illness in their jail. And they had, really during COVID was watching it closely. And what they found out or saw was that even as jail populations were dropping, either through, not doing as many bookings and using more notice to appears, and also maybe having groups that were reviewing the population and releasing early, and those kinds of practices, that the level and the number of people with serious mental illnesses was staying at where it was, if not increasing. And so it's just another thing we wanted to point out today. And as I go through these next slides about why it's so important to be able to track that population in your jail and always have a good picture of where you're at with that. So I'm going to spend a little bit of time talking in particular about the Set, Measure, Achieve, the next call to action for stepping up. Many of you maybe have already tuned into previous webinars that we had for at the national level, launching this new call to action, but we just wanted to spend some time with all of you in this kind of format today, and certainly give you more time and opportunity to ask us questions, see where you're at with this work, see if you're ready to delve into it, and how we can be of help. Next slide. So Set, Measure, Achieve, basically, as I said, is the new call to action for stepping up. And the reason that, we initiated this was that many sites, and I think many of you included, have been at the stepping up process now for quite some time. It was launched in May of 2015. Some of you have been at it for the full 5+ years, and others, several years. So we felt like even though counties across the country are in all different places in terms of their progress, it was really time to start pushing the field and really pushing towards setting some reduction targets and being able to start to measure some progress. So as we work through these different metrics today, I wanted to just kind of lay down a little bit of groundwork here. And first of all, we made a real concerted effort to make sure that the data that we're asking you to pull should all be located in your jail management system, your JMS. We realize, some of you are beyond that and you have some access to some integrated data and can maybe do some cross-matching, but for the vast majority of counties, we were thinking that it would probably be best to just work from one system. Also, we wanted to give guidance on what we felt were reasonable targets for a county to set. So what you see here are where we are starting out in terms of places to start in terms of setting a percentage. For example, the first one, a 5% annual reduction in your average daily population, a 10% annual reduction in jail bookings, and so forth. This would be that population that you have identified as having a serious mental illness. So after you would be looking at these different targets, we ask that you announce your participation in the Set, Measure, Achieve. What this actually means is anything from actually issuing a press release to just making sure that within your planning team, you have all agreed on this, you've decided to move forward. Maybe some of your planning teams report up to your local county commission or criminal justice advisory board or whatever, but that you do make some, public level acknowledgement that, you're setting these targets and it was a group process as to how you came to this point. And then that you're agreeing to measure and reporting your progress. So with those of us who are working directly with Stepping Up, we would like to have you share your numbers with us so that we can track this at the national level. Next slide, please. So setting a baseline and preparing to report. So I'm not, again, sure where all of you are at, but many of you have been working at this and you've potentially already determined what your baseline prevalence rate is, or the number of people in your jail or in your prison with a serious mental illness. And this is, again, a point where maybe we want to stop for just a second because we're trying to also include a COVID focus here today. We've had a lot of questions since we introduced Set, Measure, Achieve around, if we establish a baseline using 2020 data, is that a good place to start from? Again, if you've already been tracking it and if you feel like your prevalence rate has not changed or been that much affected by COVID, you're probably okay. If not, we know we have sites that are going back and using like 2019 data and starting from that as that baseline level where they want to start tracking their progress from. So where are you at in setting a baseline is important. Some of you have maybe already established your baseline preponderance rate, but if you haven't, then now's a good time to ask yourself these questions as far as when did you start tracking the population within SMI? Do you have new policies that have been implemented that could maybe already be affecting any reductions or changes in your rates? And then, what time periods are you going to use if you're going to just be establishing your baseline? Do you want to create a cohort, track it over a period of time, be it say, for example, 6 months, and use that as your baseline rate. So you select that baseline period after your SMI data collection was started, but ideally, maybe this is too late for you, but ideally before efforts to reduce the number of people with SMI in jail has started. Next slide. Okay, so preparing your data for analysis. So as you're moving forward in this process and you have established your baseline and now you're going to start tracking for progress, you need to, first of all, look at how you're going to pull your data from your JMS. And then when you do pull it, just checking to make sure, we'll use the term clean, that it's clean data, ready to go. So first of all, you're going to be working with the data that is tracking the bookings and releases during the time period that you've selected to track. And then the next bullet is identify true bookings and releases. So what we mean by that is sometimes it will depend on your jail policies as far as if an individual is maybe released for a very short period of time, maybe to go get an evaluation or go in and out of a hospital, do something, but they're coming back in, that would really be one continuous stay, and that you would want to make sure that you merge that if by chance your JMS system started counting that as 2 jail stays instead of 1 jail stay. And then you want to go through and make sure that all of the demographic variables that we would also be tracking through this work would also be identified and included in how you're going to sort data. So we would recommend, and you'll see this in the upcoming slides, that for every one of the data points that you choose to track, that you would also be breaking it out by race and gender and age, for example. Next slide. So now we come to the point when you're pulling your data, you want to be able then to separate your data between those who have been identified as having SMI to then the remaining being the general population of the jail. So you want to look at the files as far as where you can pull that from, and then depending on how you've set this up with your JMS, with your jail administrators, as far as you can create some sort of flag in the system or some way to be able to pull that data separately and always be able to do those comparison analysis between the population with SMI as compared to general population. Next slide. So for those of you who have maybe potentially read through the brief that we released on Set, Measure, and Achieve, and again, we'll make that available to you if you haven't had access to it. I'm just going to go through actually what is written in that brief. Also joining us today from our research team is Emily Rogers. I will be also pulling her into the conversation. She is the one that worked with the Stepping Up team as we try to pull these directions together to make them clear and usable at the county level, understanding, what data you really need, what data and how that you would be looking at, and how to analyze it and recognize if you're making progress and what potential situations you might have in terms of next steps. So the first measure is and you're going to see that these all circle back to the Stepping Up key measures, but is measuring those booking and admissions. So, it's really pretty straightforward where, you're just pulling that number. Let's say you're going to pull it for a 6-month period, and you're going to just be saying how many were booked into the jail, first with SMI and then the general population. So you want to just, again, be able to differentiate those populations, and some of the guidance that I had already given as far as you don't want to count those turnaround admissions, and you want to also likewise realize that the same individual might have multiple admissions, as you well know, in that year time frame, right? So, maybe they were in the jail for 10 days in the early part of the year, and they came back, later in the year for a second separate stay, and so those would be considered separate stays. Emily, I'm going to ask if you have anything you want to add to those directions.
No, Reese, I think you did a really
Okay. So now the next measure is for those that are in your jail, and generally, we find that this is all data that jails generally track. But what is different here is that you're pulling out your population with SMI and using that comparison. So you want to look at I think we need the slide change. I'm sorry. There we go. So we want to look at the average length of stay. Again, the jail probably on any given day can tell you what their average length of stay is, but what will also be asked is then when you pull out that population with a serious mental illness, what is that population's average length of stay? So it's very important, again, that you define how you're counting an average length of stay. I know from my own experience in working in a jail, if you were booked in at 12:01 a.m., and you bonded out an hour or two later, that counted as one full day. Most jails will have some sort of definitions. We just want to say that again, pretty much that same kind of rule would apply, that if you're booked in and released on that same day, that it's going to be counted as one day. And then for people who are released during the reporting period, their total length of stay is counted in the average. So, you know, you just want to be able to capture those individuals during that time frame for each one of those separate stays, you know, to add that into what will become that average. I would feel like this one's kind of the harder, not as easy one to think about. So again, Emily, any other additional advice? And if anybody has any questions on this, we'll stop for a minute. Anything? All right, great. We'll go on to the next measure. Okay, this one is measuring connections to care. And as you know, again, this is one of those 4 key measures from Stepping Up. This is the one where we find most jurisdictions have trouble in terms of being able to track when an individual is discharged from the jail and then verifying that that individual was referred and engaged into the follow-up treatment, supervision, care that was needed based on their SMI diagnosis and the kinds of treatment and programming that had been set up for them in the jail. So again, just going back to, you know, trying to make this all accessible within one system, within your jail management system for the purposes of Step, Measure, and Achieve. What we're recommending is if you cannot cross over and integrate that data with the other systems, is that you work with your jail administration in creating within their system some field as a way to flag that, yes, that connection did or did not occur. So generally, I mean, this can hopefully be simply added. It can just be a yes, no box. Within your planning teams, you all can maybe determine, you know, if you can define that a little farther. We see it anywhere from, yep, it was arranged, we made the contact, they were right there in the office with them, they have an appointment next week, whatever, to actually following up and then confirming that the individual not only maybe made it for one appointment, but some places we work with even have definitions that they were engaged in, that there have been at least 3 follow-up appointments that occurred. So the main thing is that this would be a percentage, and you would just be looking at the total number of people with an SMI and during that reporting period and being able to say what percentage of that group had been connected to care. Emily, anything else to add?
Yeah, I think that one thing that I would add is
Emily, we lost you.
Oh, sorry.
When
you're tracking connections to care, it's really important that you're tracking whatever ID follows the person through the jail case management system. If connections to care are tracked somewhere else, they often are, it's just important that that ID is tracked with the connections to care so those matches can be made, because that's a challenge that we've seen with some sites, is that sometimes the connections to care information will only have name or some other identifier, and it's very difficult to make that connection to the jail case management information.
Thank you. I'll stop there for a minute and just see if anybody has questions before we move to the next measure. All right. Okay, next slide, please. Okay, measuring progress on recidivism, and if your recidivism rates are trending downward. So I know that there are all kinds of different definitions for recidivism, and that you can participate in many long discussions on how you want to define recidivism. But for this project, we are, we're counting it as a rebooking into jail. So I know some of you may have other projects where you're saying it's a rearrest or it might be a conviction, but for the purpose of the Set, Measure, Achieve, we're asking that you track for that rebooking. So it's the percentage of people admitted to the jail during the reporting period who have a prior jail admission in the past year. So again, that's what you would call maybe a retrospective look at that. being able to compare back and say, you know, Joe was in, in the year prior and he's now back, so you've got that, that at least one incidence of recidivism. We know from just some of the work that we've done in jurisdictions across the country where we've gone in and done more of a deep dive on the data, if there's any way at all that you can also pull out of that information as far as the underlying reason for that rebook, be it a new charge, or if they're coming in because of like probation violation, a technical violation. Sometimes that's a great piece of information for you to have to build your your discussions and your policy changes around in terms of if there's changes or what different ways to address such things as probation violations, infractions, those kinds of things. Additionally, again, you may even want to even look at if they are coming in on a new charge, what the charges are, and just to kind of build those scenarios for you. Emily, anything to add?
Emphasize that I would just make a further emphasis that you're looking at a retrospective period rather than looking at forward events. So thank you.
And any questions about that? Again, you're going to, need to be working with your jail, your IT folks that are overseeing that jail management system, that they can be able to make those comparisons and go back and pull that prior history, which again should be something that's very easily tracked in the jail management system, and something that they're probably already looking at booking in terms of whether or not the individual's already been there before or not. Next slide. Okay, so the average daily population, this is a rate where, again, if you ask any sheriff or any jail administrator, what's your average daily population, they're going to probably be able to tell you, we have a 1,000-bed jail and today we're at 900 or whatever. But again, you want to be able to pull out of that, out of the 900, how many are those individuals that have SMI, and be able to track if that number is trending downward for you. I don't know if there's any questions on this one. I feel like it's pretty straightforward. Emily, anything to add?
Yeah, just that we're using a formula here for average daily population. Some people may use a daily count. So I just wanted to kind of point out the difference in the way that we were capturing it for this project, and just give a little background on why. And one of the reasons why is because we're we want to be able to look at a lot of different demographic populations, and there was concern we might not have daily counts for, every person by SMI, by race, and by gender. So this formula takes information that we've already collected, or you've already collected, namely the bookings and the length of stay, and it provides you an estimate of the average daily population, which will be a little bit different from your daily count. So I just want to flag that if you get, if you run this and you have a daily count, and you see the two numbers are different, they probably will be a little bit different. They're just slightly different measures. I think the important thing is to have a measure that's consistent over time, and to understand how they're captured differently. So I just wanted to kind of flag that, so that if you use this formula and you get a different number than your daily count, it doesn't cause you alarm.
Thanks, Emily. That's very helpful. And I hope that also provided extra clarification for everybody in the difference there. Next slide. So when you're setting and measuring your reduction targets, just kind of reviewing again here, you want to use your baseline data and reasonable assumptions about reductions to set those targets. And your percent change would be, looking at that current measure, that baseline measure, and then, the comparisons on your changes up or down. And I don't know if there's any questions on that before we move forward. Next slide. So that ends our section on Set, Measure, Achieve. And again, I just want to thank Emily for being with us today, helping us in coming up with these metrics and clear directions on how to track them. And certainly, if you don't have questions right now, we're going to have time for them at the end, or obviously you are working all the time closely with Gretchen, so feel free to reach out. Gretchen, I'll turn it back to you. Thanks.
Okay, thank you so much, Risa. And I'm just going to turn it over now to Annie and Rebecca to speak about their work in Cumberland County.
Thank you, Gretchen. Well, I guess I'll go first. For those of us who are participating on the call, you folks have known that virtually everything in the mental health system has been all COVID seemingly all the time and during the last year. So it's definitely been a challenging year for us. So if I could just have the next slide up, I'll start to talk about some of the things that we've seen in Cumberland County specifically. I know that early in the pandemic, when we experienced the first, I'm going to say, lockdown, some of the issues that we came up against was literally, for example, our inpatient providers were having difficulty discharging patients to the community in various, specifically our residential placements and nursing homes. And at that time, there were still some vacancies in homeless shelters and things like that. So we found people being released to homeless shelters, which was certainly not ideal. And then what started to happen is we started to see recidivism increase, both with community inpatient hospitalizations, and I believe we're seeing the same thing now with our jail data as well, reflecting that. Thankfully, at least on the civil side of things, the mental health system, the state hospitals continued to accept patients from community hospitals, and then we had multiple conversations and follow-up with many of our residential providers. So we were able to then continue to have people move to appropriate treatment and supportive settings into the community. So that eased it a bit, but it was slow. And honestly, I believe we're going to see longer lengths of stay in our hospitalizations as well, simply because of this demographic. We are still seeing a significant increase in our crisis intervention service, and we have seen, and we have Medicaid data to support this, that we're seeing increases in outpatient wait list and peer specialists specifically doubling or tripling, which has been really challenging to try to, successfully meet the need, as well as then just workforce issues across our entire community. And I think that speaks to all of us, due to illness and then people who need to stay home, and as well as fear. And honestly, when our schools shut down as well and went to virtual education, then families had to make difficult decisions about how to support their children in getting their education as well. So all of these workforce issues has just created a bit of a mess, I think, for all of us. And, the mental health system is just one tiny little piece. Certainly the whole community social services network has been very much impacted by the COVID-19 pandemic. So if I could have the next slide, please. Specifically, we wanted to talk about the impact of COVID on our crisis data. So our crisis program, I think, in the last few years have done a really nice job tracking a lot of data for us. So we're finally reaching a place where we can extract that data. And so here's what we've seen. Specifically, a significant increase in 302 involuntary commitments. And if I can maybe we could just go ahead and move to the next slide. But what you'll see here is the numbers, an 83% increase in emergency involuntary mental health commitments. That is unheard of in my 30-plus year tenure in the community mental health system. And for those of us from Pennsylvania, we know that we have flat funding. And so what that means is we have to basically move money from other places to cover this sort of need, which we have done. We are moving money from other cost centers to hire additional crisis intervention staff to try to meet the increased need. You also see a decrease in our voluntary admissions, and I realize at this point we're kind of extrapolating what that might mean. But our worry is that what that means is that people were actually more ill by the time they went to crisis. And I don't know about other counties on the call, but our experience was in March, April, there was this unusual lull in crisis services. Like everything just kind of fell quiet. And people were concerned. We didn't know what that meant. And interestingly, children and youth experienced a very similar thing where they were getting very few calls. And then it just seemed like as the pandemic has worn on, now we're seeing significant changes. So the voluntary admissions decreased, which our concern is that that meant that people were more ill by the time they actually arrived at crisis or someone petitioned on a 302 for crisis. The other thing we've noticed is a pretty significant increase in mobile response. So our crisis intervention is being called out to scenes to try to work with people. And then the number of police-involved 302s have gone up very significantly as well. So we have now actually some co-responding happening with our crisis and our local police going out to meet with people in the community. And the county seal covers up the last piece of the data point, but actually it just equates to an 18% overall increase in total cases, which again is significant in 1 year. And then to try to meet that need. And specifically, Cumberland, we serve two counties. We serve Cumberland and Perry. So the data that you're looking at actually is representative of both counties. But that kind of increase we've not seen in a very, very long time. Usually our data stays fairly consistent. The other interesting part of this data is that many of the people who are being involuntarily committed, we don't know. So it's not the people who we typically see in the community mental health system, have served for many years. Often it's people who were privately insured, perhaps lost their employment, and things started to deteriorate. So we're seeing a significant increase in people that we've not met before, which is also very difficult and challenging for us because it means that we have to be more attentive to individually meeting somebody's need, and it's not somebody who we've worked with in the past. If you could advance the slide, please. I asked one of our staff if they might be willing. In our counties, we have access to a longer-term community inpatient hospital. So we share that in our Health Choices region. So we have access to an extended acute inpatient, and that's we have 10 beds there. And so we've just ran a couple of quarters of data, and you can see that only a few people actually go to the program because there's only such a limited number of beds. But the wait times, interestingly, actually went down. So that was not what I was expecting to see. I was expecting to see the wait times go up. So we ran Q2 and Q4 data. Q4 data was where I actually thought we would see the increase because that was during the lockdown. That would have been April through June. And interestingly, we did not see this. So we're still trying to figure out what this means. And so we're going to continue to look at the data as well as some of the interesting things that maybe it means in our community. If you could advance the slide, please. Along with the longer-term care, we use that as a diversion from state hospital. And again, so our purpose is to try to support people well in the community so they can become well and, stay in the community and move on with their lives and their recoveries. But similarly, our state hospital data also told a different story from what I was expecting to see. In 2020, the wait times for state hospital actually went down, and I will say the one person early in 2020, not exactly sure what, I think that one may be an outlier, but I wanted to make sure that we were, giving complete picture of what was happening there. But again, that Q4 data, I was fully expecting to see longer wait times, and that was not what happened. So we're still trying to figure out as we work through what the data may mean. And then the next slide, please. Rebecca, I'm going to turn it to you.
All right, Tag, I'm it. So I'm the Deputy Warden of Treatment at the Cumberland County Prison, Rebecca Finke, and I've been here as the Deputy Warden since about April of 2018. And prior to that, I had been the Criminal Justice Planner for Cumberland County. So I was already I had a really good working relationship with the former warden and had worked on a lot of projects related to what was going on at the jail. So I did have that advantage coming on new. I put together a couple slides about what we have been seeing with COVID. And I'm going to tell you that today I'm very overwhelmed and tired. And I mentioned this to Gretchen when we first logged on. We didn't get to watch the video. If you have a chance, watch that. But I'm going to confirm that numbers are going up at our jail significantly in a way that it's becoming very difficult to manage for my staff. I think that what we're seeing is since November, it's gotten worse. And my fear is that going into 2021 is that we're really going to start to see, the wheels coming off. All the stress in the community, I think is hitting home. It's kind of a delayed reaction. But we have today 38 of 233 inmates that are seriously mentally ill. And that has shot up from about 9% on average to 16%. For context, I think our local hospital with an inpatient unit has 22 beds total. So we're functioning as a hospital and a half right now. I've not seen anything like this. I mean, even when we had about 354 inmates in 2019, 28 was about our highest number of Ds. If you want to go to the next slide, taking a look, every 2 weeks I run a report on the Ds and go through, see who's new, check in with counselors. I keep notes on what kind of case they are, where in the system they are, what our plans for them are. But what I continue to see on this list as we've gone through the year is that the numbers are going up because we have a lot of people here long term. Over the course of this year, we've had people come in with more serious charges, homicides and rapes. The number of competency evaluations we've had to perform on people who've come in that were completely psychotic and refused medication has gone up. In the beginning of the year, the Torrance wait times were not bad. They had improved, I think, as a result of the lawsuit. They had made some real progress in that. But COVID did eventually have its impact. Starting in November, there were issues with them having to close down, extend quarantine. They were having their own staffing issues. So we just had a young woman go who has been waiting for 3 months to get there. If you want to, next slide, please. And I would agree with Annie that the people that we're seeing are coming into the jail more seriously ill than we've seen in the past. My staff just reported to me that in January of this year, we had 18 people on a level of suicide risk throughout the month. And 3 of them were constant watch. And you can imagine the kind of stress that puts on a jail, having staff needing to sit in front of a person 24 hours a day. As of February 8th, yesterday, we've already had 14 people placed on suicide risk. And our increase in 402s we've watched over the last 5 years go from 2 in 2016 to 10 in 2020. And we were told by Torrance this year that we were number 2 in the state, I believe, for commitments to them on 402 forensic competency. So I think that may be the last slide. Is that correct? I just feel as if, jails are, we've been working on stepping up towards all of these wonderful things and improving CIT and making real progress. But when the rails come off in the community, there's no policy that we have that's going to change the fact that more and more mentally ill people are coming here. And maybe that's a little frustration coming out on my part, but I'd be really interested to hear from any of the other people that work in jails or in community settings, what's happening there, because I fear for staff. We hear a lot about hospital staff fatigue, and it's starting, to happen here. I have, poor clinicians, when they have to see people in suicide risk on a daily basis and deal with new commits and sick calls, I'm starting to become very concerned about just the fatigue and something falling through the cracks and how to support them just really on a daily basis. So.
Thank you so much, Annie and Rebecca, for your presentation. I think one thing that I was wondering when you were speaking about community mental health side, Annie, do you feel like the numbers of people accessing crisis in state hospitals has increased just because stress has increased, or does it seem as if regular community supports are not there, or is it both of those things?
I definitely think that is impacting, the lack of community resources. I think for all of us, we feel that loss. I mean, I know I do. So I think as we feel loss, and, we generally feel like we have fairly good coping mechanisms, but, we actually teach this, that we have to do excellent self-care. And for people who may have a mental illness, who may have been employed, who may have, at the beginning of the pandemic, lost their employment, and then they're at risk of losing their home. So all of those things certainly impact. And then when they present a crisis and have hospitalizations, then it becomes a spiral, a downward spiral quickly.
Okay. Thanks, Annie. And then I know that you've been kind of watching these numbers and that you have the data, but do you feel like having this data has sort of affected how you're planning or where you think you want to focus in the future when you're looking at your system and making any changes?
Well, I think out of necessity, we've had to make some changes. For example, because of the pandemic and because of social distancing, a few of our programs haven't been able to see people face-to-face. So social rehab specifically is a service that has not really been able to meet face-to-face, but they maintain contact with people by phone. So that was an area where we thought we could actually reallocate resources from, because we wouldn't need the same number of staff to reach out by phone. So that was an area where we actually took money from to move it to crisis intervention. So from a standpoint of strategy and direction, often what we keep saying is if we were able to intervene sooner and really help people get the support they needed sooner, then hopefully we could get ahead of what we're seeing in crisis and the number of people needing to go to crisis. So those are aspects that we're absolutely trying to work on. I think Rebecca mentioned about the CIT that we're working on now. So we're going to be doing some CIT training with law enforcement. I will say that this year we've really had a great working relationship with many of our police officers. So that's actually been super positive, but it's been, trial by fire.
Yeah, anytime something happens in the community, no matter how much progress you've made, just small changes can impact. You get a crop of new police officers who are properly trained yet, and then that can drive up your arrests. For-profit hospitals, with the constant changing, being bought out, their policies are different. You have to reestablish relationships. That becomes exhausting. That's something going on, in our area right now. I have, in the last 10 days, I have 2 inmates with SMI that were arrested in the inpatient unit while on commitments. And that's another thing to add to the list that's going to have to be addressed, because what is it that we're doing here? If these people needed inpatient care, then they needed inpatient care. And it becomes a very tangled web. When you're just trying to deal with those issues, but then add COVID on to top of that, when you can't really meet with people that you would normally, form relationships with and work these things out, it's very complicated. And I do wonder what post-COVID world will look like. I mean, that's talked about in other areas, that the world's not going to be the same post-COVID. So what is the landscape for this going to be? I certainly don't want to give up any progress we've made so far, but it certainly feels like, I was thinking about this, Risa, when you were giving the presentation and setting that benchmark and then those targets. I'd be afraid to tell my commissioners right now that I was even going to get a 5% reduction. I would be putting your neck out there. I think even this year we just don't know where it's going to go.
Yeah, Rebecca, I certainly appreciate that, and I don't want you to think that we're deaf to those kinds of concerns, by pushing out Set, Measure, Achieve, in the context of everything you guys are all dealing with COVID. But, I also just want to circle back to both, you and Annie and all of you calling in today who are able to pull out this data, whether you're publicly announcing reduction targets or whatever, but it's just how important it is to be able to know your data. And because I would think you are going to be asked by your commissioners, maybe state level, and certainly if we see some federal funding starting to flow, what your numbers are, what your needs are, and so whether you're saying it's going to be really hard to really actively reduce this population during a time frame when we can't even move people into community, knowing that anybody is going to be able to provide community-based services right now or so forth, with all the COVID restrictions, but just to be geared up and be ready, and particularly if you get asked questions around capacity, what do you have and what do you need, and I think another thing to look at, I think, Annie, it was you who said something around thinking that these are new to the system folks versus, that high utilizer population. But I do think, if there's any work you can do around identifying the high utilizer versus your new faces, that's also really good information to be able to have. I mean, certainly with that high utilizer group, once you can start identifying those individuals and looking at, what their services, what they're going to need. I mean, we've been working with a couple sites across the country that are identifying those high utilizers and really trying to avert, the next crisis. So, really being on top of what's going on in their lives, and if they're cycling down, if they're, if you have reason to think they're, not taking their meds, all kinds of reasons where, that pushes them back into crisis, so that we can avert that next jail admission. And, all the things you're talking around, adding, more CIT and any kinds of, co-responding teams or what have you to work with those particular populations, I think, are certainly where you maybe want to look at, what are your numbers and what would your needs be should you be in a position to start advocating for that. And I'll stop there. I just don't know if anybody has any, reaction to that, or if people are, saying, well, I can't get to this data yet, or, what is needed, or if you're all feeling fairly comfortable that you can do just what Rebecca and Annie did today in terms of being able to show some of these, really great data points on what's been happening with their populations. I think if anybody wants to make a comment, just, maybe enter it in the chat box, or, we could call on you.
Just while people are thinking about that, there is a question, can you please define a 402? I'm not sure I saw that. Could it be referring to a 302? I don't know, Annie and Rebecca, if you had 402 in your slides.
402 is when a person is not competent to stand trial. They receive a competency evaluation. If they are deemed incompetent, then they go, some communities now have programs in the jail. We do not. We send people who need restored to Torrance State Hospital. And Torrance, usually we'll have them for 60 to 90 days. We'll receive reports back. They'll tell us if they've been restored to legal competency or if they're not restorable. If they're not restorable, then they can't necessarily be tried. Depending on the severity of the crime, the charges may be dropped or held in abeyance for a while. But that's regarding legal competency. Now, these people are normally seriously mentally ill to the point where they can't understand or participate in the charges against them. And the other thing, though, is you may have a situation, which we have right now, where it's due to a TBI specifically that they can't participate. So it doesn't have to be serious mental illness. It can be ID. It can be a TBI. But they are sent for a restoration to the state hospital.
Yeah, I don't know. Let me see it. But actually, I was actually going to throw in the chat the Mental Health Procedures Act, and that's part of the Mental Health Procedures Act, Section 402. So hopefully you all can follow that link to the Mental Health Procedures Act, and you can see 402, 403. There's actually another sections that typically we don't use a whole lot because, we do our best not to be sending people to hospitals from prison. So we're much more familiar on the civil side of things, sections 302, 303, 304, 305. And so I feel like we're all learning a lot more about the parts where people are coming from prison or competency restorations.
Okay, and then we just have one more acronym clear up. This person wasn't sure about TPI. I think you said TBI, traumatic brain injury. Is that right, Rebecca?
Correct, TBI.
Okay, thank you. Okay, any more questions on their presentation before we kind of get into more of a discussion? Okay. So I think now we're just going to try and go into discussion because I know that Annie and Rebecca were also really looking forward to hearing from some of your strategies in this area. So I just wanted to kind of start off the conversation by saying that the Justice Center worked with a county in Pennsylvania to review their data and to develop a report, and they were really open with us in sharing their data with our research team, and they did everything needed to abide by all the information sharing protocols and everything. So we're really thankful to them for that. And what we found looking at their data was that during the COVID-19 pandemic, and much like the counties that are featured in the video that we were unable to show at the beginning of the webinar today, their rate of SMI did not change significantly. And we can see from the data that people with less complex needs were released first, and people with more complex needs, including people with SMI, were released later on in kind of a second wave. So the data that county has can help them to see who's in their systems and the impact that new policies or practices that they may have implemented during the pandemic may be having on their populations. And this data from that county matches what we've seen in other counties as well, with regard to the proportion of people with SMI remaining largely the same, even as jail populations might decrease COVID-19, or in some cases, the SMI population has been rising. So this lends itself to what Risa kind of mentioned earlier regarding how even though this might be a strange time for data and data collection, data can still be used to set targets and to understand progress. So since this is just a really unprecedented period of time, even just sharing challenges that you may be experiencing and any responses that you feel like might have worked well would be great to hear. Even if you have a challenge that you don't feel like you really have a strategy for yet, we can even use this time to brainstorm, and maybe there might be a county that's on here that's found a good way to deal with that challenge. So I think on the next slide, there's just a few kind of question prompts to get people thinking. You definitely don't have to, if you take yourself off mute or if you put something in the chat, you don't have to respond directly to these, but just in case they kind of help people think through all of this. We just have, what are the biggest challenges your county's been facing during COVID-19? Any strategies? How might data be able to help during and post-COVID-19? And are there new policies or practices you think it would make sense to retain post-COVID-19? So I'll just give folks a few moments to see if anybody wants to share anything in the chat or speak up about that.
Gretchen? I think Ashley Yinger might have her hand raised.
Oh.
Yes.
Thank you.
Can you guys hear me?
Yes. Hey, Ashley.
Okay. Sorry, I had to participate via phone today, but I wanted to just kind of chime in a little bit whenever, is there another county that's willing to share some things? Due to me running back and forth between meetings today, I don't have things pulled up on the computer since I'm on my phone. But we did not see as big of an increase as what, Annie and Rebecca shared with Cumberland County as far as numbers going up in the jail. Initially, we saw the opposite. Now, a lot of that was geared towards, we put kind of a mini work group together with our DA and the warden, and really took a look at individuals that, were in for minor offenses and, looking at their bail and charges. And so there was a proportion of inmates that we were able to get out right away whenever the pandemic started. And then for our weekly mental health group meeting that we call Team NISA, we then took a look at those individuals, and there was some individuals there that we were able to get out. Now, interestingly enough, we did hit a barrier with some of those because a lot of our residential services initially, were having openings, and then some of our individuals that were waiting for residential, once the pandemic kind of got a little bit further in, we could not get them in because they were following, strict COVID guidelines and really, did not want to bring anyone new in. So for us, a lot of it was putting things on hold. And what we have seen, there's been kind of a pro and a con to virtual mental health services. We saw some individuals that, liked that. They actually found participating via virtual, they were more willing to kind of show up, for lack of better words. But then we definitely had individuals that, really needed that in person. So it was kind of a balancing act of making sure that, they had housing and services set up. So I would say, initially we were able to get some people out, but at the same time struggled. But then we kind of really hit a plateau in the sense of we didn't really see any kind of increase or decrease. We definitely maintained our individuals with SMI not staying in the prison as long compared to those with not SMI. But I would probably say in the last month or so, our numbers have went up a little bit. So those that are open with county mental health and identified as the D roster with our prison, the numbers have went up, not significantly, but definitely went up. I think when I looked at it on Monday, there was 130 people in our prison that had SMI, where I would say pre-COVID, we were about the 90 mark. When we got into the pandemic, I want to say we filtered anywhere between 100 and 110. Give or take, sometimes it would go up to 115. But, yeah, interestingly enough, I would say the last month it's went up. And I know some of the individuals that I have spoken to of working on their cases, I know they've just expressed it. They've kind of hit, like, their wits' end. Like, now things are really starting to, like, vamp up with their mental health, of, you know, being stuck indoors and, you know, not having access to some of their additional supports. But I would agree with Cumberland County and our 302s, they have definitely went up. And I don't know if that's a combination of course, you know, I'm sure some of the pandemic, we've definitely seen a mixture of new people as Cumberland and some of our original, you know, ongoing people. But we've really implemented the co-responder model in 2020. And so I have 6 of them out and about, and I don't know if the combination of working with police every day has, you know, I have no idea if that has any factor, but every month when I look at the numbers, I have noticed that our 302s have went up in a lot of the cases where the co-responders are involved. But then ironically, so we've really, the co-responders has went extremely well, but I've actually had to cancel some CIT trainings just due to COVID restrictions. So I just wanted to share that definitely with Cumberland, here in Dauphin, I'm seeing some things that are similar as well.
Thank you so much, Ashley. Annie and Rebecca, I don't know if you wanted to respond at all to that. It's okay if not.
No, I just wanted to make sure, does she work in the jail or in the community? It sounded a little bit of both. Like she was very aware of the...
Oh, Ashley, did you try to say something? I think there were two people talking at once.
Rebecca, I work with the district attorney's office in county. I serve as the stepping up coordinator, so I'm working with the jail probably on a daily basis.
Oh, okay. Do you work with Catherine?
Yes. Yep.
Okay. All right. Then I do know who you are. I remember when she was hiring you. Okay. Nice to talk to you.
Same to you.
When you say normally you have 90, but now you're up to 130, did I hear that correctly?
Yes, I would say pre-COVID, when we really started addressing some of our stepping up initiatives, those individuals identified as an SMI that were in the Dauphin County Prison, it would range anywhere between 90 and 100. Every now and then, a few weeks, it would go up to 110, but I didn't really see a whole lot higher than 110. And then in the last few months, it would filter around about 115. And then just last week, maybe 2 weeks ago, time's flying for me, but I do at least know from looking at the data yesterday, because I get a report every Monday, and the number was 130 yesterday, and I haven't seen that as high almost, I guess, would it say over a year.
Yeah, that's a significant increase in that short amount of time. I mean, I would say it's hard to adjust and care for that many that many people when they're rated a D. And are they finding it harder to find places for people to go?
Yes, initially, yes. Now we run into the problem. We definitely have our fair share where some serious charges. So trying to kind of divert them and get them into programming has been, a little bit more difficult where our hands are kind of tied, especially with how our office is proceeding with those charges. But with the ones taking that proportion out of it, initially, yes, we were struggling to get some individuals that met the criteria for going into a residential program. But just recently, actually at the end of January, we opened up a new forensic residential that's a short-term 90-day program, and it's meant for individuals getting out of the prison. And we put our first person in at the end of January, and they can accept up to like 16, 18, or is it 14 beds. So they're slowly vamping up. They didn't want to take all participants all at once. So we're hoping to utilize that and get some more people out. I honestly would say, mental health for sure. I mean, we definitely have that going on, but we have gotten hit really hard with drug and alcohol.
Yeah, and co-occurring, I imagine. And
yeah,
I think on our last TA call, Gretchen, we discussed, how many people are coming in here, and it takes us weeks to tease out whether it's one or the other or both, because the behavior's the same and they're completely psychotic, and that is definitely a problem, Ashley, all the way across the river here too.
Yes, the drug and alcohol, and I agree. It's trying to figure out, which is kind of coming first and which is the priority with the mental health and drug and alcohol. But we've definitely got hit hard on that, and we've had a lot of individuals that meet the criteria for inpatient for drug and alcohol, typically dual. And so we're just trying to work it out with our office based on their charges. And so some of them we've definitely been able to divert and get them inpatient, and others, unfortunately, with their charges, we kind of have to wane out the process a little bit.
Okay, great. Thank you so much, Ashley. And I think that issue with the drug and alcohol, I feel like a couple of counties have brought that up in our TA call. So if anyone wants to comment on that as well, that's totally fine. I also just wanted to point out, we got a comment for Cumberland. Thank you, Bobby. And she said, could the county or local region investigate the development of a long-term residential facility and community-based competency restoration as an alternative to lengthy waits within the jail setting? She said she's not familiar with Cumberland County's community mental health plan or services available, but it could provide some initial resolution.
Well, actually, we literally just opened a long-term structured residence. We built it from the ground up. That's what we did last year during the beginning part of the lockdown. It was licensed in September of 2020, and we are still struggling with fully staffing it. I believe there are currently 9 individuals there, and part of the development of the program was that we would be working with individuals who have prior history with the justice system or who are incompetent to stand trial. So some of the admissions have come from state correctional institutions, some have come from CCP, and some have come from Danville State Hospital individuals who were incompetent to stand trial and who had met the maximum benefit of treatment while in the state hospital system. So we have it about half full now, and trying to hire the staffing that we need to bring it up to the full capacity of 16.
That's great. Thanks, Annie. Okay. Any other comments or questions? we're almost getting to 4:30. So if not, I think we can just go to the next slide. So this is just sort of a reminder that we're doing, I'm in the midst still kind of our next round of one-on-one TA calls. So if you haven't heard from me yet and you're interested in receiving a TA call, please feel free to reach out and we can schedule that. We're also going to be putting out soon an application for site visits if counties are interested in that. That'll be sent out soon, and then we're going to have another webinar or training in March, at least one. So that's just what's on the horizon. We always welcome feedback, I just wanted to say too, so feel free to reach out to me regarding any additional follow-up to the webinar that you'd like to see from the TA Center. And we will send out a recording of the presentation when it's available. And I just wanted to thank also so much Annie and Rebecca for your presentation. I know you're so busy right now, so thank you so much for putting this together. And also Teresa for her presentation on data as well. And thank you to all for participating. And my email's up in case anyone needs it for questions or feedback. So thank you so much, and I hope everyone stays safe and healthy.
All right, thank you.